Welcome to the WHN broadcast. I'm your host, Katie Marsh. Keeping kids healthy, avoiding getting sick over and over again, and preventing harmful long-term immune and health consequences remains a huge challenge. We know what we need to do to make things safer. Some parents are using home, remote, or collaborative schooling, but many are unable to, and safety in most schools is inadequate. There remains a lot of pressure not to require masks, and testing, which was used in many places, is currently not widely discussed. One of the best opportunities for improved safety is cleaning the air through ventilation and HEPA purification, but it is getting a half-hearted treatment or none at all. It doesn't have to be this way. There are two things we can do. First, focusing on clean air opportunities, as this intervention often comes with least resistance. And second, to reintroduce a wider set of precautions. As we will see, the powerful and wealthy business and political leaders are implementing strong health precautions for themselves. Precautions shouldn't only be for the wealthy and powerful. We need the same in place for everyone to stop transmission and prevent the short and long-term risks of COVID infection. Today, we have Michael Bailey from Indoor Air Care Advocates, who will share ways his group advocates for clean air measures in schools. We will talk with Antonio Boulier, who leads a community education program in Texas that implements precaution strategies with great success. And in a major development for keeping kids safer in schools, Colleen Miller, Executive Director for the Disability Law Center of Virginia, we'll talk about their victory in a federal court case that allows schools to use peer masking. Finally, we have Shay O'Neill, a member of WHN's Schools Safety Team, who will explain how to approach schools about what is called a 504 plan to create a safer environment for an individual student. She will also review other safer schooling options. Thank you, Michael Bailey, for joining us. Michael, you and your wife, Tara, and friend Jennifer Yarborough head up a group called Indoor Air Care Advocates. I'd love to touch base with you about the progress of your work with advocating for clean air in school. But first, let me ask, why should we focus on indoor air quality?
Yeah, first of all, thanks so much for having me. And to answer your question, I would say the objective is just to have clean air, just like we've accomplished with having basic standards for clean water. In short, that just involves cleaning the air by way of removing harmful elements like pollution, toxic chemicals, mold, viruses, allergens, etc.
Yeah, when you put it that way, that makes a lot of sense. So how does one go about cleaning indoor air?
Yeah, the two simplest ways are actually pretty mundane. One of them is ventilation by bringing outdoor air in from outside. And the other way is filtering the air to remove unwanted particles, such as if you were to use a DIY air purifier called a Corsi Rosenthal box or a portable HEPA filter.
Yes, in fact, we've just seen a lot of pictures circulating from Davos at the World Economic Forum with these interventions. Many precautions were taken. Every room had a strong ventilation system, HEPA air filters. They had so much outside air coming in. In fact, you'll notice folks were dressed very warmly. Some were even wearing winter coats. So if some of the most powerful and important leaders went to these lengths to clean the air, shouldn't our children also be afforded the same health protections?
Yeah.
Now, what can parents ask of their schools to get the air in schools as safe as it was in Davos?
Yeah, we need to protect our future important people as much as our current important people. So at Indoor Air Care Advocates, we published a parent advocacy guide that's 54 pages of information. At the top, it's less than that, but if you want to dive really deep, we've got it all for you. And it just helps parents understand how to connect with people and advocate in schools and educate schools on indoor air quality, because not everybody has become, a professional and become familiar with all the recommendations. So we're helping parents familiarize schools with that. All parents should be asking for 6 things. Schools should be forming an air quality plan that includes monitoring CO2 and airborne particles in classroom. They should be improving and quantifying ventilation. That's one big thing, is that I haven't seen a lot of quantification. We needed quantified improvements in ventilation. They should be using portable HEPA filters to bring the air change rate up to 6 to 12 air changes per hour, according to the recommendations we've seen. And they should be upgrading the HVAC fans to accommodate MERV 13 or better filters. And finally, they should be making sure that they're not using any technologies that haven't been recommended. And I'm talking about the recommendations by mainly EPA, CDC, and a professional group called ASHRAE. And their recommendations all take time to set apart these electronic air cleaning things called ionization and photocatalytic oxidation. And many of them also, and also the experts, are saying that foggers are in the same camp. Don't add things to the air. The problem is subtracting things from the air. And so that's one of the things you should check with. And the last thing about those 6 questions is that parents shouldn't accept wording that goes like, to the extent possible. Those words have done the most work of any word since 2020. It's just not good enough. It needs to be challenged. Finally, we really need to find other like-minded parents through, PTO groups and PTAs, through the World Health Network, through Facebook groups at covidmeetups.com, various places. We just need more voices asking for these really reasonable things.
So this is all great. In an ideal situation, say you get a school that fully cooperates and you verified, you tested the air. Is this enough to stop transmission?
Okay, well, that's a good question. If we hit the baseline of these recommendations, we can reduce the exposure and the transmission in some studies by 80% or better. But if you're looking for better than that, I would point you to a really prominent HVAC expert, Bill Banfleth. He's the former president of ASHRAE. He is the current chair of the ASHRAE Epidemic Task Force. And he has basically said, HVAC is not the only game in town. Do the other layers too. And at Indoor Air Care Advocates, I'm focused solely on indoor air quality. But if I take that hat off and just speak as a parent, I know those layers should include wearing a high quality mask, such as an N95. And obviously, we've already talked about how portable air cleaners can help. But also, if we take it right back to Davos, where we started, testing is another layer that we can use. And we can use all those layers to reduce the likelihood that a person will be there who is sick to begin with, and keep things safer. So it's not going to stop transmission to do these ventilation things. It's going to decrease it so that when we apply these other layers, we can be successful.
Yeah. So what do parents do after they attempt some of these conversations with their schools to verify and follow up on the air quality?
Yeah. So parents have gotten various kinds of answers, as you'd expect, ranging from outrageously positive and a little dubious, all the way to no answer or an unsatisfactory answer that doesn't really quantify anything or give anybody an idea of what's been done. And in all of those cases, one of the things that we've done is send a CO2 monitor to class to help characterize the ventilation to the extent that we can, and either refute outrageous claims and bring them to the attention of the staff, or find out what the quality of the ventilation is. If they're not speaking on it, you can find out. And if the schools don't give quantified answers, we parents have our ways. So in one case in Berkeley, Michigan, there was a father being told that the schools were giving 10 or 12 air changes per hour of air. That means that the air in the classroom was being swapped out with new outdoor air 10 or 12 times an hour, which would be outstanding. But he sent a CO2 monitor, and we computed that it was something closer to 4 air changes per hour. And when he compared this with the value that was in the information from an open records request that he requested, he found it was within a few percent. So basically, both the open records information and our CO2 monitoring confirm they're not getting the air change rate that they were kind of advertising. And 4 air changes per hour is actually better than a lot of schools are doing, but it's not meeting the recommendations that are supposed to keep kids healthy and in class and keep teachers from having sick days as well. So we have our ways of getting solid information, like I said. And we've been working with families around the country on all of this. And we've been taking notes from all these interactions. And we're hoping to be able to highlight examples of schools that are keeping kids and teachers healthy and in class and getting good grades and performing by applying these authoritative recommendations for air quality.
Yeah, I mean, hearing that parents have access to these resources and the tools, honestly, is so comforting. We really appreciate the work you and your group are doing to get this information out in an accessible way. So thank you so much for coming on. And if our listeners would like to connect with this group for support, please go to the link at the bottom of the screen to get the Indoor Air Care Advocates website address. Thanks again so much, Michael, for coming on with us today and sharing this really important information.
Thank you so much.
We welcome Antonio Beeler, director of Abrome, a private school in Austin, Texas. We are honored to have you with us today, Antonio, to speak about your success with COVID safe protocols. But first, could you tell us about your approach to education at Abrome?
Sure, thanks. We are a small independent school in Austin, Texas, and the things that really make us what we are is that we are a space where each kid has their own self-directed education, and we center everything around the notion of community care.
Great. So you mentioned community care, and I'm wondering, how did you come to decide to take on COVID safe protocols in your school?
We had always focused on this notion of making sure that we're not creating harm by the ways that we come together. And so when the pandemic hit, we were like most people, just we didn't know what was coming. We knew that it was bad. We knew that it was potentially really, really bad. And the very first thing that we did was we locked down before the state did, and we just said we're not going to come in person because we just don't know what what the impact is going to be. And then as we learn more and as society moved forward, we just kept coming back to what people had been identifying as there are certain groups of people who are going to be hurt by this much more than others. And we need to have a sense of equity. We need to have a sense of like recognizing what that harm is. And we need to be able to imagine that there's going to be future follow-on effects and consequences that we can't even conceive of right now. And so we just felt that it was essential that we did everything that we could to make sure that we weren't unduly making the situation worse. And so that's sort of been the North Star for us the entire time. And as we've learned more with the rest of society, that has allowed us to take different approaches, and our protocols have evolved over the past 2.5 years. But we always come back to the question of, who is this impacting, and is there a way that we could do this that doesn't cause harm?
Great. Yeah. Thank you. That makes a lot of sense. So just wondering, what types of COVID safety protocols have you put in place? And you mentioned that they have shifted over time. Could you speak about how those shifts happen, how they get determined?
Mm. Well, at the beginning, March 6th was our last day of 2020. That's when we broke for spring break, and then we extended spring break an extra week, and then we eventually, I think on April 1st, just said, actually, we're just going to be remote for the rest of the year. And then the rest of the schools in the state pretty much did the same thing. So that was pretty standard for a lot of people. The next academic year, 2020 to 2021, we didn't know much, but we knew from other people reporting on it that indoors was just really risky. We knew that the chances of infections indoors was just much greater. We had been hearing that COVID is airborne from people, even though that wasn't the official line. And so we just said, we're just going to go outside this year. We're not going to mess with it. And so we went outside and we had small cohorts, and we did symptom screenings every day. And we masked whenever we were anywhere close to one another. So that was our entire first academic year. And then the second full academic year, as we learned more, we added filtration. So we added HEPA purifiers, and we built some Corsi Rosenthal boxes in the space. We added a vaccine sort of qualifier because there were people in our community that were unvaccinated previously, not even COVID related vaccines. And that's just a very standard thing in private schools in Texas. And we were trying to figure out how do we allow them to participate in this, but also recognizing that this potentially puts other people at risk, and certainly puts them at greater risk if they're exposing themselves. And so we had sort of vaccine qualifiers for if we do come back together indoors, we have to have really low case numbers for that to even be a consideration for the unvaccinated folks. But we created risk levels that were that did reflect to some degree what public health risk level cutoffs were. And as the risk went up, as spread went up, as the positivity rate went up, we would decrease the size of our group, so our cohort size would get smaller. We always mask, but we would increase the distancing requirements for people outdoors, and we were still going remote. We did it when we were entirely outdoors the year before, and then last year we still went remote during the waves because we just figured at some point it doesn't matter if you're outside and you're doing everything right. If there's a good chance that someone's infected, that does create enough of a risk that spread might happen, and also just the risk that we contribute to a bad situation even worse, like the waves. The impact on the ability of the medical systems to be able to respond to so much infection with all the other stuff that they deal with, and that's kind of the approach that we took last year, and it worked to the extent that we didn't have any transmission. But then last summer, I actually the World Health Network reached out to me and asked, well, have you thought about testing? Why don't you test? Is there any way that you would consider testing? And so that is something that we looked into, and because of the World Health Network, we were able to bring in family pooled diagnostic lamp testing this year as an additional protection. And we also finally made the call to say, hey, we are going to be fully vaccinated as a community. So that was a little difficult because we had people who were unvaccinated prior to the year, and we just said, moving forward, we're just going to be vaccinated, except in very rare cases of medical necessity, of which no one has met that sort of exception. And that's the approach that we're taking this year. So we're still distancing, we're reducing capacity as cases go up. We'll still go remote if things get really bad, but we do daily lamp testing, pooled surveillance lamp testing. We're always masked. Even when we're indoors, we don't take our mask off to eat or anything like that. There are no mask breaks. If you want to eat, we go outside, and we improved our ventilation and filtration, mostly do it yourself and portable units, but every single room at the Abrone facility is over 12 air changes per hour. And we hope that it continues to work. we hope to be zero COVID, for good.
Yeah, well, this is a very impressive set of protocols that you are following, and clearly they are working. You're not having transmission, you're not having cases in your school, which I think our viewers at home will feel very happy to hear that these success stories do exist and that schools like this are alive and well. Well, like I said, it's so good to have you on and to share about the success and to hear about the initiative that you took even before the pandemic to start this self-directed education program in your school, Abrone. That's just an inspiration. And I think the words to have parents explore other options and get allied with other like-minded parents for cooperative options is a great place to start. And hopefully more and more folks will, and that will make everything a little bit safer. So thank you so much for joining us today. Again, so great to have you on, and we look forward to working with you more in the future.
Thank you.
We now turn to Colleen Miller, Executive Director of the Disability Law Center of Virginia, an attorney who was involved in the Virginia lawsuit that reversed the governor's order prohibiting school masking. Colleen, we are so glad that you've joined us today.
I'm glad to be here. Thank you.
Great. First, could you tell us about the Disability Law Center of Virginia and the work that you do there?
Thanks, Katie. I'm really grateful to be here. And yes, I'd love to tell you about the Disability Law Center of Virginia. We are a statewide organization that works on systemic and individual issues as they impact the rights of people with disabilities. We do this through a variety of means. We do this through individual representation, sometimes very simple negotiation to try to resolve legal issues. But sometimes, as we'll talk about today, we also have to file lawsuits. And finally, our big systems effort involves work at the legislature. A year ago, our work at the legislature was to try to inform the legislature about the dangers of the law that they were considering passing that would have enforced Governor Youngkin's executive order. As we're going to talk about, Governor Youngkin's executive order gave exclusive rights to individual parents to decide whether children could wear masks in school or not.
So let me ask you, the legal basis for this suit is upholding the Americans with Disabilities Act. Can you tell us how the governor's order prohibiting masking violates the ADA?
Happy to. The Americans with Disabilities Act, as I'm sure many of your listeners know, applies to public entities and to government entities. And on the parts of the law that apply to government entities, they are required to make reasonable modifications to their policies and procedures in order to accommodate people with disabilities. It was the nature of this exclusive, no exception rule that both the governor and the legislature passed that violated that part of the Americans with Disabilities Act. So that if an individual with a disability needed a modification of that policy in order to be able to safely go to school, the school was not able to do that. And that put them in direct conflict with federal law.
All right. Yes, that is clear. And that does seem like a problem. And we're so glad that that was fixed with your efforts. All right. Speaking of the court case, could you tell us about some of the court arguments and evidence that was compelling that won this case?
Perhaps the most important thing about our lawsuit was that we were not seeking universal masking. We were not seeking a ruling that said schools must mask their children. We were seeking a ruling on behalf of 12 individual children that they could not go to school safely unless their peers were masked, and that they wanted the ability to simply request and negotiate whether their peers and teachers could be masked. That's really all the order provided us, is the ability for these 12 children to request for their classmates to be masked, to request for their teacher to be masked, and then to negotiate that request with the school districts.
So the settlement restores the possibility of requiring peer and teacher masking as reasonable accommodations, but who decides if peer and teacher masking is required to protect a particular child?
So that's what the federal law refers to as the iterative process, or it really just means negotiation. The parent makes the request of the school. The school could ask for some additional information to support the request, but ideally what they do is they engage in a discussion about whether this is the only way that somebody's needs can be met. Are there other things we can think about? And how can we protect the rights of other children in the classroom? Ideally, it's done as a discussion, a negotiation, where the parties come to an agreement together. And in the vast majority of cases, that is how it is resolved. everything that I'm involved in, I would say probably 98% of those issues become resolved just through negotiation if the parties come to the table in good faith. But if they're not able to resolve that, the parents can either file a claim under the Individuals with Disabilities Education Act, which has its own procedural process to resolve disputes, or they could file an additional claim under the Americans with Disabilities Act to enforce it.
So I think many of our listeners at home may be thinking, how could I get such a suit going for my own child if they're faced with a similar situation in the state or county that they're in? So where would you advise that parents start in order to put a similar action in motion for their children?
I would say that if your listeners are in Virginia and they are having trouble with that, they should feel free to give us a call and we'll help them try to resolve it with their school districts. In other states in Virginia, I think that it would be a good place to sort of start looking at our website, look at the settlement agreement, look at the complaint that we filed in federal law. And I would say that parents can probably just simply pull that information and share that with their school districts and say, this is what happened when a lawsuit was filed in another state. Surely you don't want that to happen in this state. My guess is that many states will be, many school districts will be cooperative and try to resolve things in compliance with the Americans with Disabilities Act. But unfortunately, some are not going to be. Some of them will really dig in and insist that there can be no masking. And then individuals might have to seek attorneys to represent them. Every state has got an organization similar to ours. It's called a protection and advocacy organization. So if they're in another state, they can just Google protection and advocacy and the name of their state, and they should be able to find that state protection and advocacy agency. We all have different names, but there's one in every state.
All right. So thank you so much for coming on with us today. And thank you so much for your efforts and your dedication to these families and to upholding the American with Disabilities Act. We look forward to perhaps working with you in the future. Have a great day.
Thank you.
The WHN School Safety Group has been gathering information about what are called 504 plans. The CDC has stated that children who are vulnerable to being very sick from COVID or have family members that are vulnerable to being very sick from COVID can request special measures called accommodations be implemented to protect them from the disease. This is independent of the presence or absence of other forms of disability. Let's go to Shay O'Neill, a member of WHN's school safety team, for some info on how to use a 504 plan for COVID mitigations. Hi, Shay. What is a 504 plan and how can it help?
Hi, thanks for having me here. Yes, I've been working with our school safety team on putting a guide together. So a 504 plan is based on anti-discrimination laws that protect disability rights and prevent discrimination in schools. It's been cited by both the CDC and the Secretary of Education as a tool that can be used for making special accommodation requests for protections for students and households at risk for COVID-19. The CDC says that schools must, quote, consider the needs of people who are at risk for getting very sick with COVID-19 or who have family members at risk for getting very sick with COVID-19, as they may require additional protections to ensure they can stay safely in the classroom. So it's a formal way to get the discussion going between parents and schools so that the student will be safe in the classroom and able to keep vulnerable household members safe. Any parent can email the school's principal requesting a 504 plan meeting where you can put together a list of accommodations like getting a HEPA air purifier or CR box in the classroom, CO2 monitoring with action, special seating and eating arrangements, flexible attendance policies with ways to make up missed work, and even peer masking, as we heard from Colleen.
Yeah, so does the school have to comply with those accommodation requests?
So Although the student is protected under state and federal laws, this is still a negotiation process between the student and the school, and it's decided on a case-by-case basis. Accommodations are usually determined by two factors. One, how to keep the child in the classroom safely. Two, without causing undue hardship to the school. So, for example, a student's family may request a HEPA purifier be put in the classroom, and the school may say they don't have the budget to pay for one. So maybe the family would offer to provide it, or they would find a way to apply for a federal program that covers the cost for one. But if you feel the denial of an accommodation is unsubstantiated, they're just not going to talk about anything that you're requesting and they're not giving you reasons, you can file a formal complaint or follow up legally with your state's disability firm. That's one of the benefits of having a formal discussion. And I think it's really important that both the school and the family remembers this is not about politics, personal opinions, or even about COVID-19 policies. This is about creating an inclusive learning environment for students and families who have risks of being very sick, need to be COVID cautious for themselves and their households, and require reasonable accommodations in order to have access to education. These negotiations can go well, as Colleen mentioned earlier, but if you and the school do not come to an agreement where you feel your child and household are protected, there are alternative educational options available to look into in the meantime.
Oh, that's great. What are some other options available for education?
So for starters, you can look into local private educational programs like Abrome mentioned before that do have acceptable COVID precautions in place, or that can fulfill special accommodations. There are also public virtual schools available that are free and have teacher support, as well as homeschooling, which now has more resources available than ever before. And any of these can be supplemented by social virtual programs and safe in-person socials. Many groups have popped up online over the past 3 years, such as virtual classes and tutoring on outschool.com and allschool.com, parent support groups on Facebook, places to meet others locally with similar COVID precautions on covidmeetups.com, and organizations, including the WHN, that marry socializing with helpful information and advocacy for safety.
Thank you so much, Shay. This info ought to be very helpful for parents looking for safer options, both in and outside of schools. So for more information on 504 plans and alternative school options, click the links below in the description. And I just want to say thanks to all of the guests today for joining us. Again, we have links attached to the broadcast. For more information and resources, check out our website at worldhealthnetwork.global. If you'd like to connect with like-minded individuals and families in your area, join covidmeetups.com. Thanks to everyone who tuned in. We look forward to seeing you soon.